Mississippi, as well as other states across our nation, are experiencing a nursing shortage. In Mississippi, the vacancy rate is greater than 8% for registered nurses. And as a part of that nursing shortage, we have to look at the faculty shortage. We did a survey in our state and determined that in the next 3 years, we're looking at about a 30% vacancy rate for faculty. Much of that vacancy is due to retirement. So therefore, in order to address the nursing shortage in our state, we also must address the faculty shortage.
The Mississippi Office of Nursing Workforce, ONW as we fondly call it, was very active in projects from pipeline through graduation. And we were pleased with those projects, but there was one area that we did not have an active initiative, and that was in regard to the faculty shortage.
There weren't enough nursing instructors, and students were being turned away. And these were students who had acceptable GPAs and acceptable backgrounds who would make good nurses.
I think essentially we were all in our own worlds, doing our own thing, and we as a healthcare organization were very concerned about the nursing shortage and how to staff our facility, and the shortage of nursing instructors and the ultimate shortage of nursing students as a result of that.
Historically, there's been pretty much a great divide between education and practice. We'd get together to talk about student placement for clinicals and some of those kind of things, but with no real strategy and no real vision for the two working together to improve the health care for the citizens of our state and beyond.
The Mississippi Office of Nursing Workforce, through a grant called Partners Investing in Nursing's Future, received funding from Robert Wood Johnson and Northwest Health Foundation, as well as a match funding from our state, the Mississippi Department of Employment Security. Through those funds, we have been able to look at what we can do to have innovative partnerships in our state. We've brought service and education together to work on what they can do as partners to address the nursing shortage as well as the faculty shortage.
The project has given us the opportunity to look at what other people are doing across the country. And we had successful projects before the Penn project, and I think the tendency is to be proud of those successes, but not necessarily to look at the full richness of what other people are doing and look at opportunities that we had to grow. And so this project is somewhat unique in that it has encouraged and pushed us to do that, and that has paid off with us being able to see wonderful projects across the country that we plan to replicate moving forward.
Typically, you're in a very competitive environment with other hospitals and other healthcare facilities, and being able to come together in this type of setting and working with this group and this partnership has given us an opportunity to have somewhat of a neutral ground where we aren't quite as competitive. We share many of the same issues and concerns, and we can work together as a partner and address those issues.
And for a long time, up until some of these initiatives started working, we didn't have the pool of applicants for nursing education that we need. That is changing. That's making a big difference. But it's essential that in a state with 2.8 million people that's largely rural, that we collaborate, that we look for innovative ways to share best practices, and that we figure out how to teach our students in an environment that is creative but also high quality.
The partnership between Mississippi College and Mississippi Baptist Medical Center really was finalized and formalized about 2.5 years ago. One of the major advantages of that partnership, I think, has been the fact that we have communicated in a more formal fashion. The Office of Nursing Workforce, ONW, began with meetings where we came together as a group and talked about issues with regards to nursing with the School of Nursing, and this began that formal relationship.
Initially, when I arrived here, being new to the Jackson area and new to Central Mississippi Medical Center, one of the first things I wanted to do was to establish a relationship with Hines Community College. They have a very large nursing program, which is an ADN program, and a very good reputation. So I spent a good bit of time trying to work with the folks over at Hines, Libby Mahaffey and Deborah Spring. And at that time, I didn't have my current Department of Education established. And soon after I arrived, Jackie came, and one of the things that benefited me was that Jackie had been here in the Jackson area in nursing for a lot of years. I'm not going to tell you how many.
We started the partnership with Hinds Community College. We used one of our clinical educators in a clinical extender role,
whereby we supplied a master's prepared nursing instructor who was on our salary and our benefits program, but provided instruction, both clinical and classroom, to the students at Hinds.
And so that faculty member comes with students and does clinical 2 days a week, and they actually do that at the hospital, the sponsor hospital. And then she's also able to spend another part of the day with students giving feedback on paperwork or answering questions and those types of things.
When students came in to a clinical environment, it's almost like an alien being coming in because they're not part of the established working relationships. By bringing someone in, the students in, and having them paired up with our own employees has made them part of the working relationship. They haven't had that barrier that existed before between clinical and the actual employees of the hospital. They've become part of the team.
We have had more clinical rotations of the nursing students at Central Mississippi since that began. We have also increased our hiring of the new graduate nurses. This past summer, out of the June graduating class, we had in excess of 30 new graduates, which is the most Central Mississippi Medical Center has had in a number of years.
You tend to lose nurses in the first 6 months to 2 years. If they can find an environment in nursing school that they're comfortable with, and then they choose to go to work in that environment after nursing school, you've already bridged that gap of trying to fit in, trying to assimilate, trying to become part of a working program. So when they come into us, they know their coworkers already, they know the environment, they feel comfortable. They also feel they have a mentor in the educational department because they're very comfortable down there now. So it's a win-win for them on that.
Baptist had one of our faculty work across the summer when we do not employ them in their education department. This faculty member went and worked with students in the nursing externship program and was employed by Baptist Hospital that summer. Our students, many of them, because of the affiliation, because of their clinical sites being at Baptist Hospital, realize that Baptist does employ students. They also will provide them money to go to school in agreement to come back and work for them after graduation. And a number of them have taken advantage to do this.
We have seen tremendous benefits at Baptist. We have evolved from having very low recruitment classes of students, and this past year we had the highest number of recruits that we have ever had.
With the partnership, we have seen an increase in the number of our students in the summer who sign up for externships with Baptist Medical Center.
One of the things that we have certainly realized is that the old solutions do not work anymore, and neither can we go at the old pace, the slow pace that we have run into due to bureaucracy in service, education, and other areas. So with this initiative, it has been very rewarding to see that people are working together and they're willing to break up the old paradigms and they're willing to come up with very new ideas, very new collaboratives that previously have been said to never be able to occur.
The challenges continue to face us head-on as we look at nursing vacancies and faculty vacancies. The heart of our mission is to face those challenges and to address those challenges.
In the future, I believe that our experience with the PEN project will help us put nursing on the agenda of other foundations and other funders, particularly at a local and regional level.
I think the trust factor is going to carry us into the future to enable us to think outside that proverbial box in a way that will affect the future for decades to come.
It's just another extension of what can happen between education and practice to really strengthen the graduates when they get out of our programs.
We have innovative partnerships. Each of those partners are working together to meet this challenge. We pledge to continue to work with our state to address the faculty shortage as well as the nursing shortage and meet the needs of the communities and the people in the state of Mississippi.